Hi, everyone. I'm glad everyone could join us for the Going Digital Behavioral Health Tech Conference. I want to just first say a thank you to Salome, who puts on an incredible conference each year. I think it gets better and better each year. I'm Shana Hoffman, and I'm the president and CEO here at New Directions Behavioral Health. I've been with the organization about 18 months and really excited to share. I spoke last year and excited to share kind of the continued updates and really the evolution of our organization. We've gone through pretty significant transformation over the past 18 months and are excited about what is to come for us in the behavioral health space, particularly as we work on access to care programs. So today I'm going to talk about 4 areas here. The first one is, as some of you might know, we actually acquired a company called Tritium back in January of this year, and we're bringing together really technology plus the services capabilities from New Directions. And I'm going to talk a little bit about what that means really for our organization and for the industry. I'll touch on the current behavioral health landscape really in the context of some of those challenges that we're seeking to solve as an organization, really from a platform perspective in the industry. Then I'm going to talk a little bit about our Navigate Connect product, which is really purpose-built to solve those access to care challenges and some of the really novel ways in which we're tackling that at scale across the industry, particularly to support payers. And then I'm going to share some results that we've actually had with our Florida Blue, one of our health plan partners, in driving reach, speed to care, and quality, which will be themes that you're going to hear me talk about quite a bit during our session today. So just to share a little bit about both organizations, for those of you who are familiar with either New Directions or Tritium, or neither of us or one of us. So New Directions is a behavioral health company that's been around really for 27 years, purpose-built for behavioral health alone. We service 15 million lives in 50 states and worldwide, and we enjoy 7 partnerships with Blue Cross and Blue Shield health plans, and really are in the process of inking additional partnerships with other health plans, both in the Blue system at the regional level and actually at the national level as well. And we really are a services company, so we are very kind of invested in our clinical teams and our people on the New Direction side. And then Tritium is actually a technology company based in Philadelphia. Again, I mentioned we acquired them in January of this year, and they also have a really historic tradition in the behavioral health space, over 20 years of clinical research, and really started out actually as a measurement-based care company. And we'll touch on the importance of that later when we talk about the quality component. They serve about 1.4 million patients across 11,000 providers and really bring a technology capability and a platform, which you'll hear me talk quite a bit about today, to the behavioral health care system. And so combining these two capabilities, really the technology from Tritium, the services component from New Directions, really we believe is kind of what the industry needs from a solution set perspective in order to really solve the access problems from a behavioral health perspective at scale. So kind of the combined company, as we're on this journey and evolution together, we really believe that what we're bringing to market is the leading behavioral health optimization company. And you'll hear why we believe kind of this word optimization company. It's sort of an interesting language choice that we're going to talk a little bit more about during the session of what it is that we're optimizing. But essentially, we are providing really the infrastructure for health plans, providers, and employers to optimize that access to behavioral health care. And I think this is an important component. We really want to sit as kind of the infrastructure inside health plans that are being able to help optimize all of the work that health plans are doing, whether they have a vendor partner for behavioral health or whether they're doing behavioral health themselves internally, and do that through quality, speed, and outcomes. And so if we think about kind of the core tenets of what we're doing and really with our Navigate Connect product, there's 3 kind of primary focus areas here. One is around reach, which is really, we're focused on 2 things within the reach segment. One is we know that there are many, many members, particularly with the kind of prevalence of behavioral health conditions right now, seeking access to behavioral health care. And that's not necessarily, you'll see the stats in a second, the easiest thing for patients to get connected directly to care. And so we want to think about reach in terms of how are we getting the members that are presenting and seeking access to behavioral health care services really connected into care. The second kind of component of reach, which we think is equally, if not sometimes more important, there's a pretty significant portion of the population that we would call kind of the untreated or undertreated members from a behavioral health perspective. And what I mean by that is, if we actually look at prevalence of behavioral health conditions and utilization within a given health plan, it sits somewhere in the sort of 13, 15, 18%. I don't know where it should be, but I actually would argue it presumably should be probably in the 30% range. And the reason why is there's so much kind of unmet need for behavioral health services when we look at kind of patients with chronic disease. Even if we think about somebody that has a hip or knee replacement, right? We actually believe they should have a co-occurring screening for behavioral health needs to be able to pair up some lightweight services kind of coupled up with that surgery that would yield to positive outcomes kind of post surgery. And so when we take a look at our data, it's critically important that we're connecting patients that are kind of self-presenting with needs for behavioral health, but also that we can identify through analytics people that might have co-occurring, for example, rheumatoid arthritis, and be able to try to reach those patients and get them connected into care. And that's where we see, pretty significant total medical expense benefit for people that were not previously in care. The next component is around speed to care, which if we now have both people that we've identified that we think would benefit, as well as people that are presenting with needs for services, we want to be able to connect those patients to care quickly. And what matters here is being able to do this across the entire acuity spectrum. So when we think about the competitive landscape and sort of all the different types of organizations that have popped up, there are many, many point solutions that are able to kind of promise speed for a particular condition, for a particular service type, right? So you might be able to get a virtual appointment for outpatient therapy in a certain amount of time. We actually want to be able to do this, and we are doing this at scale. You'll see some of the results later, which are pretty incredible, to be able to schedule patients into care, whether it's for EAP services, for coaching services, for outpatient services, for substance use disorder services, all the way through the acuity spectrum. And being able to do that with a reliable kind of speed to care that is much lower than what the industry average is. And we'll talk a little bit about how we do that. It's really through being able to direct schedule patients into care so that we can close the loop kind of at that first point of contact. And then lastly is the quality piece, which I think, access to care without quality is really going to be actually more detrimental to our industry rather than helpful. And I think there's, again, just so many different access to care solutions kind of cropping up, but they don't really build in this quality component that we think is really important. And so we'll talk a little bit about kind of the measurement-based care component that we believe has to kind of be built in. So these are kind of the three key tenets. And interestingly, we've kind of organized our company, both with Tritium and with New Directions, to be focused on these areas where we have people that are accountable in the organization for a reach metric or for a speed to care metric, and that's how we've aligned our operations. So I want to turn a little bit toward kind of the behavioral health industry and kind of current dynamics that we're seeing. And again, for many of you on this conference, I know it's a very, usually the audience is very well versed in behavioral health industry macro trends, but really, we continue to see very high prevalence rates, anxiety, depression. You see kind of the data here. And I think, it's no surprise to everybody that we've continued to see an increase in anxiety and depression levels compared to pre-pandemic levels, as well as, while there's been such a focus on anxiety, depression and outpatient treatment and all the services for people for those conditions, there's also really continued to be an ongoing opioid crisis and really significant increases in overdoses year over year, which again is just a continued kind of concerning trend. If we couple that kind of the macro trends up with what we see for people that are trying to access care, is that we still see, concerns around stigma. And I think the interesting thing here, when we think about stigma, is particularly as we target the untreated and undertreated population, that's where we believe there's really significant stigma exists, and there's really significant need that's actually not being serviced. I think there's actually been kind of stigma reduction in some of the lower acuity needs population, where people are, willing to kind of seek out outpatient services or coaching services, and there's kind of been that stigma reduction. But I think as we look at the population that really has, significant need, and may need to be routed to a psychiatrist for med management services, or may need to kind of get into outpatient therapy and doesn't even know that they need it, which I'll come to in a second. That's where we see that, there hasn't been as much movement from a stigma reduction perspective. So still a lot of opportunity and need there. That comes into the second point of people needing to navigate to the types of services that are going to be a fit for them. And I think, for us who are in the industry, we are very well versed, right? When I talk about different modalities and whether it's virtual or bricks and mortar and different, levels of acuity of services, for many people, that's not their kind of natural language that they're using. And so there still is really this challenge that we see, and we very much see this kind of in our call center for patients that are seeking referrals. They're calling us and saying, things are not going well, here's what's going on with me, but there's not the ability for them to translate, okay, therefore I need X type of an appointment. And so we really see this need for kind of care navigation services to help people who are in need of behavioral health services identify what is actually the right solution set for them. And then, there's still challenges around kind of finding an in-network provider. And that is really important for us as a health plan partner, is that we do believe that people should be able to use their behavioral health benefits and see a provider, a high quality provider with speed that is an in-network provider for them. So, that's kind of the macro landscape. I think if we look at how that manifests, with a health plan for an individual member, this is really kind of where we're trying to break the mold. And so today, if you look across really any health plan in the industry that is doing behavioral health services, the status quo for a member that is seeking access to care is the one that you see here. And so basically a member, self-identifies here. We have Janet, who's a 23-year-old female. She identifies that she has a need around anxiety and depression, right? She's calling in, and I think just one note here is we do see a very significant number of members that are calling us to get referrals. So yes, there's very much a robust kind of digital self-navigation piece, but there's also a very significant number of members that still are calling into health plans to that point around the care navigation of what do I actually need for services. So Jessica calls in, she's given, risk screening and triage. This is pretty industry, standard. That's going to help identify her level of acuity and flag if she's at risk. And then based on what she needs, she'll be most likely, and every company is a little bit different, right? Somewhere between 7, 10, 15 names of providers. And the onus is basically put on, Janet here to try to find the provider herself. So she's going to be given that list of names. She's going to start calling around. And, I've sat in many kind of call center side-by-sides, and what you'll see is Janet will probably call those providers, and then she's going to end up, and this is why you see this loop here, struggling to actually get connected to a provider, because providers either don't pick up the phones, right? Depending on the group size and scale, they may or may not have a practice administrator, or be, able to sort of service that from an administrative need. They might not be accepting new patients. They actually might be on our insurance roster panel, but then say that they're not accepting insurance, right? We see all sorts of different challenges. But again, that's on us as a health plan partner. But yet this is, for Janet, a really big, difficult barrier to overcome to actually access care. And again, she's really overcome the highest activation energy to say, I'm going to raise my hand and seek access to care. And we're not delivering, for Janet to get her actually connected. And so when we talk about kind of the macro trends and then kind of why we've brought our two organizations together, it's really to break this industry status quo. And so if we look at kind of this workflow that we're, as New Directions plus Trinium, enabling here, you'll see it's, significantly simplified relative to the workflow I just showed. And the reason why is, when Janet's calling in to us, and we'll talk about, we have this deployed with one of our health plan partners today and the results we've seen, but when Janet's contacting us in the new scenario, we're using this Navigate Connect product with Trinium's technology here, we have Janet calling in. We're able to screen, triage her, and then we're able to actually direct schedule her into an appointment. So true kind of first call resolution, where Janet is going to leave that phone call with an appointment booked. And the really cool thing about this is we're booking her in about 5 days to appointment for both bricks and mortar and virtual services, whether it's outpatient, whether it's therapy, or whether it's psychiatry. We can get her connected into any type of care that she needs. So stealing a little bit of thunder from the results we've seen, but really, really powerful that when Janet is calling in, she's actually leaving that phone call with a booked appointment. This has been really transformational actually for both Janet as the member. We've seen, significant member kind of stories from people saying, I had no, expectation when I called in that I'd be able to get scheduled with an appointment. But it's also really important for our care navigators who, all of our care navigation teams and our clinicians that work here, they really want to help members to the maximum extent. And so giving them a tool, because we're using kind of the Tritium technology to enable this, allows that agent who's speaking with that member to really do something transformational for that member that's on the other line. And so we've seen really cool stories as well from our care navigators and our clinical teams that they're able to do this. So if we just sort of compare and contrast, the sort of status quo workflow, which you see requires a lot of looping back and forth on sort of steps 3 through 5 here, versus kind of the simplified flow on the bottom. This, we believe, is really that operating system that I was talking about to help drive access to care, where we're actually doing this at scale for our health plan partners. And we, again, think that's, really the right thing to do for members, and something that we would like to see, every health plan in the country kind of have this as their new status quo. And that's what we're trying to drive through those partnerships. So just to talk a little bit more about sort of what that workflow looks like, from a product perspective for us. So the first step is really there's this identification step, which this is sort of where is the demand surfacing for the needs for that population. And so here we use analytics. So we're looking for those people who are in that category of untreated or undertreated that I spoke about before. It's from members that are self-identifying and picking up the phone and saying, hey, I need help. It can come through digital partnerships with health plans who are seeking to help members who need behavioral health services get connected in, or it can come from a referral channel, whether that's primary care or other kind of referral channels. And then regardless of what channel that's coming through, those members are working with our behavioral health care navigators. And I do really feel like it's important to have a human in the loop. I think behavioral health needs are very, human needs. And interestingly, we see about 10 to 15% of our members that call in or that get connected via these channels, screening positive to need a clinician in the moment. And so in that moment, you really want to be able to hand that person off to, again, a trained clinician to have that conversation with them if they are at higher risk. And then from there, we're able to do the connection piece, which can have any number of different resources that we're connecting them to. And I think importantly, now in our arsenal and toolkit from Tritium is the ability to direct schedule into providers. So I want to talk a little bit about the direct scheduling piece, because I think, as we're talking to different health plan partners and industry players, this is really kind of the novel piece of what we're able to do here. And the way that we really are able to do this is we're recruiting providers onto Tritium's platform, and then that's allowing us to actually see the schedule availability of those providers. And so again, in the workflow that I showed you, the current state for Janet, when we give out those names of providers, we have no notion of what they might actually have for availability. So it's also possible that somebody does pick up the phone, but says, okay, I only have a 3 p.m. Wednesday slot and a 5 p.m. Thursday slot, and the person is seeking, something later at night, right? And so when we have kind of changed that, so now we actually can see that provider availability. You can see here on the right-hand side, where there's that direct scheduling piece, we actually know where the openings sort of sit within the network. And that's what's allowing our care navigators, our clinical teams, to actually be able to schedule that patient directly into care. So there's really this notion of unlocking capacity, which I think has been really novel for us, is that when we look at our provider network, there's this notion of access to care challenges, but when you actually start to surface up the slot level availability, you find that there is capacity in the system, but it's all about how do you surface up that supply side to be able to effectively match it to the demand that's presenting through the channel. The other beauty of this is that you don't need to get the whole network kind of onto the Tritium platform for this to work. And I think this is, a little bit of an aha moment when we're talking with health plans as well, is that you just need enough capacity to service the demand that you see presenting through your channels. And so it's this kind of ongoing support mechanism that we do to help kind of build, that network supply side. The other thing that we're doing is really trying to build this smart stack. We call it the smart network stack. And the reason why we talk about it that way is that there's really an important critical piece around getting bricks and mortar providers on, which I just showed on the prior slide, how we're getting that availability. But then what we want to actually do is stack in the virtual kind of capacity together with that bricks and mortar supply. And so we can take what a health plan, if they already have kind of partner assets, you can think about the likes of the NoCD or an Able to, or some of the partners that I know are all kind of speaking at this conference as well. And you can stack those together with your bricks and mortar supply. So essentially you screen, triage a patient, identify their needs, and then say, okay, I have, these virtual options available for you, or I have bricks and mortar. And that's where you then see now, if I look at kind of gray and green slots here, you start to see that there's pretty significant supply in the system. And so that, again, is just really kind of the game changer of this smart network stack that we talk about, that we're kind of creating for health plan partners. So if we just turn for a second, I talked a little bit earlier about the fact that, access without quality is really, I believe kind of more detrimental than it is helpful to the industry. This is where the benefit of Tritium kind of being purpose-built as a measurement-based care platform comes in. And so as we recruit and onboard providers onto the platform who we're using to be able to schedule these patients into care, there's also a component of being able to have kind of the quality and outcomes pieces that we're really excited about. And that's something that we believe that over time, right, the more interventions and kind of experiences that a given patient has with that provider, the more data points we get, which allow us to, one, start to fingerprint essentially providers and patients to figure out the quality of the match. So yes, we're matching on kind of those demographics and gender requirements and racial preferences and all of those pieces, but then we also can start to match on quality of who do we know is going to be a good fit for what the needs you're presenting with. And so it's that kind of feedback loop that over time will evolve. It also then allows health plans and providers to say, hey, I have enough data here to support understanding what a value-based arrangement could look like. And so we think there's some really cool opportunities when we look at substance use disorder treatment, for example, where we have providers that are using the platform. We can schedule patients into those providers and over time kind of measure those outcomes pieces as well. And so just to, sort of close the loop on that Navigate Connect product, which again, we're really excited about in terms of what it's going to enable for the industry in terms of kind of access to care at scale. And we're really excited to be able to bring that to the behavioral health industry. First is really allowing us to increase that reach. Knowing that we have that supply side of providers available allows us to kind of differentially try to get to as many members as possible and get them connected into care. It really improves kind of access to care at scale. Because it allows us to see for those needs that are presenting, for that demand that's presenting, how we can appropriately match that to supply. And then, importantly, as I mentioned, the kind of quality enablement as well to kind of create that full kind of loop that we talked about when I showed that triangle earlier. So just before we close here, I just wanted to talk a little bit about the results that we've seen to date. So we actually launched kind of with the Tritium solution prior to the acquisition in December of 2021. So we'd been working with Tritium all of last year. And since we deployed, so essentially what this means is for a Florida Blue member that's is a customer of ours today, if they call into our referral center, we're actually screening, triaging them using the platform that I talked about in this Navigate Connect product and direct scheduling them into care. So here you see the data From that, we've screened over 3,300 patients. We've scheduled over 1,100 appointments. And the really cool part is we're seeing, again, kind of here, this 5 to 6 days to appointment. And it's across both bricks and mortar as well as virtual. We actually have seen an increasing trend for patients seeking access to in-person services. And this is also across both outpatient therapy as well as psychiatry, which again is just one of our first people we booked was somebody that called in on a Wednesday and had a med management psychiatry appointment on a Friday. So really exciting for us to be able to deliver this to the industry. And if you just look at kind of the booked appointments by type, you can kind of see some of the splits here of what is going for med management and therapy. And I think, again, the importance of that med management piece, and particularly being able to book bricks and mortar kind of psychiatry appointments, is really important. And then you can see kind of the splits on what's been booked for virtual versus in person. The other thing that's really awesome is that we are actually able to know in a given market. So we know for Florida, for example, how many slots are available in the next 2 weeks. So if you're thinking about kind of as a health plan partner, being able to offer that up to kind of your client customer base in terms of what that availability looks like, this is really, really groundbreaking. And you can see here we've really focused again to match that need to have a significant proportion of bricks and mortar appointments available as well. So with that, I just wanted to close here and say, one, again, thank you so much for having us. I think we wanted to share this really because we're excited about this, both from a product offering for obviously the shared organization, but also from the perspective of what we believe we can kind of help the industry move toward. Again, we think that there needs to be kind of these at-scale solutions that allow us across the acuity spectrum to bring together all these really great point solutions and sort of sit in the middle as that routing engine. And that's what we're really excited that we're doing today, and we'll continue to build on these results and kind of bring that high quality kind of technology enabled services to the industry. So really, really appreciate you all having us and look forward to speaking with many of you following this conference.